Hey there, thanks for joining us on this Sunday. Let us start with news of that healthcare deal. After months of stalled negotiations, the provinces do appear to be one step closer to signing a new healthcare deal with Ottawa. The premiers are looking to meet here in the nation's capital next month in the hopes that this new money could be reflected in the upcoming federal budget. Earlier, I spoke to New Brunswick's Premier Blaine Higgs about this breakthrough and what comes next. Premier Higgs, nice to see you again.
Nice to be here, Rosemary.
Okay, so the federal health minister, Jean-Yves Duclos, said on Friday that he's very optimistic, that you're moving towards some good outcome for the healthcare deal. How would you characterize where the provinces are at right now with Ottawa?
Well, that's my understanding as well, which is very encouraging because this has been a long process that has really ramped up in the last several weeks. So that is good news. And I am optimistic that we will strike a deal in February. And so that'll be good. And hopefully I'll be in Ottawa and with my other colleagues, and that'll be determined at that time.
Great. Well, if you're going to be in Ottawa, I'll drag you in here to talk to me too. Tell me what has what has changed or what has unblocked in these last number of weeks, if you had to point to something.
Public opinion. I would say that the public are expecting a better healthcare system in our respective provinces. They're expecting, given what we've gone through with the pandemic and what we're seeing, every hospital strained with being able to provide services and personnel. I think they're expecting that, if we're putting more money in the system, we have to see results as a result of that. And I think that, that's not an unreasonable request. And, I've been always a bit focused on outcomes with spending money as well. And I think that the federal position on this was based on certainly public opinion, and I think we've all realized that is appropriate.
It does seem as though Premier Legault and Premier Ford have evolved to your way of thinking as well in terms of data sharing. I'm sure that must have helped unlock things as well, that everybody's starting to get on the same page as far as that's concerned.
Yeah, it has, and we've had good discussions internally through our respective meetings, and I think we recognize that the sharing of data is a good idea because we will see different provinces have different maybe levels of care, mm-hmm. and we can all learn from each other.
Sure. And
best practices through different provinces is of value.
It's my understanding that what's on the table here is a deal for a decade. Is that accurate? And is that the CHT transfer that's going to last a decade and the side deals on other issues? Or is it just one part or the other?
Well, it would be my hope that this would be a transfer based on the CHT, and it would be something that would be continuous. And it wouldn't really have a time limit on it. We get a CHT transfer now that's based every year. We're looking for a continuous upgrade to that. Now, on the 10-year portion, if something arrived there, it might be based on evaluating the performance in different areas and those standards and deciding, okay, we need to raise the bar here collectively. And that's fine, but I think we want to get on a continuous funding model.
These sort of additional bilateral deals, and I don't expect you to negotiate in public, but are they is the idea that beyond the healthcare transfer increase, that these are tailor-made solutions for each province? They would look different from one province to the next, or what is your understanding?
Well, the bilateral concept at this phase, I guess, is getting beyond the fact that we're sharing data, and so the provinces all agreeing to do that. I would guess that in the sense the federal government would evaluate that and say, okay, here's some areas that this province has, this province has another, and so we'd like to see improvement here because we're trying to raise the bar, and I think that would be the next phase. So if the bilateral portion is phase 2. Then it becomes just based on what we see as opportunities, which many of them we likely already have a pretty good insight into.
The Globe and Mail is reporting we're talking about $70 billion. Would that be about right?
Well, yes, I guess it's. We don't expect that it's going to hit the maybe the mark that we set for it, but I guess time will tell. But any progress in that direction is welcome news. So we always want to move forward.
Let me just run past some of the areas that Mr. Duclos calls the shared priorities. That's sort of the new language, so we don't call them strings anymore, I guess. He talked about 5 of them: reducing backlogs, supporting healthcare workers, better family health, mental health, and just modernizing the healthcare system. Is there any of those? Are there any of those shared priorities, those 5 priorities he laid out there, that is more important to you and to your province, or that you think is more urgent?
I think the access is key, and so primary care access. So every citizen has an opportunity to gain access when it's needed, and that could be at different levels, what's required, but have primary access. So that's key. I think access to critical surgeries, in a timely manner. So if in one standard, if we talk, with an aging population here in New Brunswick, if hip and knee surgery is critical, our wait list shouldn't be longer than the national average. Right. So if our wait list is 2 to 3 years, and the average is a year, we should be able to find ways to get that down. And I think having that understanding across the country, it might be saying, okay, we need to maybe, who knows, we could get moving some surgeons around in areas that need to have a focus in order to get the standard, equalization of results.
Well, it's interesting you mentioned that, because Doug Ford said that Ontario is going to adopt this new as of right rule that will allow healthcare workers to move throughout from other places in the country to Ontario to work. And I wonder whether that raises any concerns for you, that you are all going to start poaching from one another. Like, how do you prevent that from happening, Premier?
Well, it does raise concerns. We have already started that in our Atlantic region with our 4 provinces here. So we've already asked the College of Physicians to standardize our criteria so that our doctors here in this area can move around between our 4 Atlantic provinces. So we've already done that. Now, but we all recognize that, if that changes with Ontario and Quebec, the stakes become a little higher here for us because of you're right, the poaching and moving. So there is a concern about that. And I guess we'll see where that goes. I think my point was that if we find standards in some areas that need to be raised, so we have a better access to healthcare in certain areas that maybe other provinces are doing much better at, or vice versa, then we should have that ability to move surgeons or move doctors in order to raise the bar. So you go in for quick hits, so to speak, and you spend a month or 2 and you get caught up. That's what I think the mobility could be very critical all through the country, and that's why I think that standardization of certifications could be useful in that regard. If it's a method to draw healthcare professionals to one area, it becomes problematic for sure.
You talked about primary care there. The New Brunswick Health Council on Monday released a report saying your province has a wait list of 75,000 patients seeking primary healthcare providers. This is not news to you, obviously. What needs to happen if this deal happens in the next number of weeks? How quickly can you start correcting that issue, do you think?
Well, it is getting better. I mean, that number seems a little high to me right now for the numbers that I've seen. We have had a big increase in population, which was unique here for generations. We've had a higher population growth in the last 2 years than we've seen since Confederation. And so we've had 65,000 new people come to the province. And that has increased the access issues in the primary care. I think our number is lower than that, but we're doing it through access in many different categories, whether it be pharmacists, whether it be practical nurses, or nurse practitioners rather, or whether it be paramedics, it would be in the primary care community centers. So we're ramping up in having access in different ways. So it's not just an emergency room, because emergency rooms continue to be overloaded.
So let me end on this. If there's a deal soon, and everyone seems to be on the same page on that at least, how hopeful are you that there will also be change as quickly as you can make it happen?
Oh, I think we'll all expedite it, and we are doing that. I think the other area that's critically important is electronic records, that we all have a system that can be interfaced with each other, and certainly provincially, but interprovincially as part of an overall strategy. And I think we can move the bar quickly. And I think we can focus resources where they're needed the most. And having an oversight, I've always been kind of an advocate that best practices should be shared across the country, and we learn from each other. And I think this is a move to doing that. So I feel pretty good about that.
Okay, Premier Higgs, always nice of you to make the time. If you do come to town, I will hold you to come and do an interview with me here, if you don't mind. Thank you, sir.
Oh, yes, it'd be my pleasure. Thank you.
Okay, good to see you.
Take care.